All right, we've been sent in a case to evaluate a site, edentulous site tooth number 13. We have CEREC data in there, so obviously we're looking at a digital process for our surgical guide, whether that be OptiGuide, Digital Guide, or CEREC Guide 2. I'm assuming in this case CEREC Guide 2 because we don't have a full arch scan. But the bigger question on this particular one, at least the question as it was sent in, was regarding the hook on this root. And this is one of the nice things about 3D and one of the important things about going through in 360, for example. So, if we looked at it just from this angle right here, we would consider maybe putting this implant over here and doing different things. But we've got to look at our implants in 360 degrees and we can see how that looks. Now, my bigger concern with this is going to be certainly the size of the implant. 3.2 by 8 is pretty small, so I would like to at least get a 3.7. The other reason I like to get a 3.7 implant in here is that it does give me the ability to restore with CEREC. That's the first thing. And then second thing, in looking at the plan overall, I can see that we're coming out the mesial of the tooth. So I would just quickly move that over a little bit, like so, and then maybe even kind of like that. And I might cheat a little bit here and try to avoid that root, kind of like so. And now I'm pretty much centered. I'm looking at the ability to do a screw retain restoration. And now the question is going to be, how close to that root are we going to be? And man, we are tight. We're tight here on the distal, getting close to the mesial part of tooth number 14. We're just tight. I mean, the alternative is going to be, as you had it earlier, is to maybe plan it as such, make a custom abutment, or look at doing an angulated screw channel if that's an option with your system, and then try to do it that way and try to see if that works. But again, this little hook on the distal is proving to be problematic. The alternative choice again would be a 3-unit bridge. Orthodontics is not going to do any good here. Hemi-section the root sounds crazy, or sorry, vertical section in the root there sounds crazy. And as we can see, as we rotate our 360 view, we can see we even have a little bit of a hooked root on the mesial buccal of that tooth. Now I'm assuming that we also did notice the residual infection here on the mesial buccal root right in here on tooth number 14. So hopefully that's being treated. And so let's take a closer look at that. And we can see right here that that may be the cause of this issue going on in the sinus. And then as we kind of take a look through our implant here, we can get a better look at where we are in relationship to that adjacent root. So right here, man, that's really tight. I would just give the patient the options here and show the patient this is our choices and these are the risks associated with doing this type of treatment, and see what the patient is interested in doing, and then make the decision based on that, and go from there. And if the patient's willing to accept the risk, and you're willing to accept the risk, move forward. But if the patient's not willing to accept the risk, then maybe look at a 3-unit bridge after dealing with this mesial buccal root. Thank you very much.